Ashley Jetta Garcia is a Colorado native and 2 degrees from Regis University. Actually, 3 degrees. 2 bachelor's degrees, one in mathematics and business administration with an emphasis in international business, and then a master's degree of science in criminology. She's also pending her PhD in forensic psychology. She also has extensive experience in many different industries: information technology, legal, security, safety, investigations, and project management. She has worked in the private sector for Fortune 500 and Fortune 100 companies, as well as in the public sector. She started working in the insurance industry in 2018, 6 years ago. Ashley always strives to enhance her understanding of different marketplaces and leveraging her traits as a dependable, well-rounded, organized, business-savvy, and complex problem-solving mathematician. With her vast experience in education, she is able to be the best health insurance advocate and representative for her clients in the market today. Ashley, take it away.
Good morning, everyone. Welcome to BNI Recommend Elite. We are going to be talking about what's going to be happening in 2025 with health insurance. Some of this will not pertain to everybody, but in my own opinion, I have a feeling it's going to affect everybody at some point anyways. So let's get started. First and foremost, this is all educational. This is not me giving you any information about health insurance or your health insurance or anything else. So let's get started. Let's do a quick understanding of the government approved insurance so that we can kind of understand the different avenues that are available. First and foremost, we have on market, which some people say on exchange for people who are under 65. And depending on the state you live in, you'll either be on the federal marketplace or the state marketplace. And then for employers, there's also the shop, which is where you can get yourself and all your employees health insurance for employers 1 to 50 that are full-time, and some states it'll go up to 100 employees. Then we have Medicare. This is for U.S. citizens or people who have legally resided in the U.S. for at least 5 consecutive years and are at least 65 years of age or under 65 with qualifying disabilities. Medicare has 4 different parts to it. It has Part A, B, sometimes there's C, and then the Part D. And then we have Medicaid and CHIP. These are state health insurance. Medicaid is a federal and state partnership where they provide low income people or people with disabilities and sometimes families and children health insurance that is state funded and state run, and that partnership comes with both the federal and state level. And then there's CHIP. This is for any children under 19 where their family doesn't qualify, meaning their parents don't qualify for Medicaid, so they'll still get coverage, and then their parents will go elsewhere to find insurance. In addition to that, then we have other insurances. So we have off market, okay? And the biggest thing with off market plans is we want to make sure that you get IRS form 1095 or something similar, because you want to make sure you get credible coverage so that you don't end up getting penalized by the IRS or your state. It's all the same. So it's either state or federal where they can penalize you for not having health insurance. So those plans, they can be individual plans and they can also be group plans. And then there's all these different supplemental insurance that you can always add on to any insurance policy. And the best way to think of the supplementals is that you usually add them on and turn them on and off whenever you need them. Okay. So for example, you have dental, vision, hospital indemnity, cancer, life insurance that can have living benefits, and then traveler's insurance. And so with these plans, you can stack them on top of your current insurance plans as well, just to give you extra coverage. So today we're going to be talking a lot about prescription drugs. So I wanted to make sure that we have a better understanding of the prescription drugs and what it entails. First and foremost, there's just something called a formulary list. These are prescriptions that are covered under each plan, and the plan dictates what they're going to cover for your prescriptions. Okay, meaning that you don't get that choice. It's the plan that chooses that. So it's really important, especially in the next few years, that we are looking at prescription drugs to make sure that you're on the right plan with your prescription drugs. And then the majority of the plans are structured with a tier 1 through 5. And the best way of understanding this is the higher the number up to tier 5 that you go, the more expensive your prescriptions are going to be. Some plans do have tier 6 as well, and it depends on the plan and how that is structured. But the best way to understand this is, again, if you have a prescription that is in the higher numbers, you're going to be paying more. Okay, so tier 5, you're paying the most. All right, so let's talk a little bit. This is more on the Medicare side, but again, I have a feeling that this is going to impact all people, because the reality is the insurance companies have to make sure that they have the money to pay their bills and do everything that they can to keep their business running. And so even though this upcoming year is going to change for Medicare, they're going to be spreading the wealth, spreading their costs, understanding and making sure that they can pay their bills at the end of the day. So let's talk a little bit about the true out-of-pocket cost. What that is in the Medicare space is it's for your drug plans. And what it is, it's a combination of what the enrollee, which is anyone who's on Medicare, and the company who they choose to have their prescription drug coverage with pays over time. Okay, that's pretty much all it is. And the best way to understand this is that there are certain things that do not count for your troop. And what those are if you purchase anything outside of the United States, if it's something that's not covered within the formulary list, if it's excluded from Part D and or a supplement, it's like hair growth and stuff like that. And then also over-the-counter prescriptions, because there are some Medicare plans that allow these, they have over-the-counter benefits. Those do not count towards this true out-of-pocket. So why is this important? Over the last few years, we have had a change in the different plans and how they're going to be structured within the Part D, which is a prescription drug. So for 2024, and the orange is going to be the enrollee. The enrollee pays 100% of the deductible. And then when they're in their initial coverage, they pay 25%, and the company that they choose to have their prescription drug plan with pays 75%. And then some people might have heard this in the past, that there's something called the donut hole. That's going away as of the end of this year. So this is a coverage gap where it doesn't matter what the prescription is or where you're on the tiers. When you get into this coverage gap, you pay the enrollee pays 25%. The plan will pay 5%, and then the drug manufacturer will pay 70%. And then when they get up to an X amount of dollars, then they go into this catastrophic coverage where the plan pays 20% and Medicare pays 80%. What's going to be happening in 2025 is that the deductible, again, the enrollee is still going to pay that 100%. In the initial coverage, they're going to pay that 25%, but it's every other stage. So the plan, the manufacturer, and Medicare that are going to be changing. So with the initial coverage, the plan is now going to be paying 65% instead of 5%. The manufacturers are going to be paying 10% instead of 70%. And then in the catastrophic phase, where the plan was only paying 20%, they are now going to be paying 60%. The manufacturers are going to be paying 20%, and Medicare is going to be paying 20%. Meaning that a lot of the costs are going to be now be responsible for whoever your prescription drug plan is with. So these costs need to be covered somehow. And I'm going to show you guys like the standards of what is an enrollee is going to be having to pay. And then it'll kind of make a little bit more sense of medication is expensive. Let's just put that so that we're all on the same page. But with the 2025 standards, the deductible for an enrollee, the max that any prescription drug plan can charge is $590. And then remember that initial coverage is that 25% is all they'll pay. And the max they'll pay through the entire year is $2,000. Right now, when they hit the catastrophic, it's $8,000. So it's going to be a $6,000 difference. They're only going to have to pay $2,000, but that means that the more the money is going to be falling more onto these insurance companies. So a benefit for the enrollees is that their prescriptions are going to be front loaded, their cost is. So Medicare came up with a Medicare prescription plan, payment plan, where enrollees can elect, you have to opt in every year into this program, and then you would pay your prescriptions throughout the year instead of upfront. You would pay your deductible and then the 25%. So over the year, you could pay $2,000 monthly instead of upfront. So how is this really going to affect everything? These are predictions so that we're all on the same page. Okay, this is your assumptions. We'll see what really happens. First and foremost, there's going to be higher premiums. There's going to be fewer plan choices. There's going to be stricter formularies. I'll explain what that means in a second. And then there's going to be more pre-authorization, step therapy, and quantity limits on any and all of the prescriptions that run through this. And within the formulary list, the guidelines for Medicare is they are required to have at least 2 drugs for each class, except for these 6, they have to have most of the drugs. So we might see that the formulary list shrinks so that these companies, insurance companies, aren't paying a bunch for the prescriptions that someone might need that has cost a lot in the previous years. So let's talk about times to pick your plans. Realistically, on the individual market, it is November 1st through December 15th. There is a little extra time, but for the cutoff for December 15th, that's when your plan would go into effect January 1st. And then after December 15th up to January 15th, they usually give a little bit more of a grace period, but then your plan would start in February 1st. And then obviously we always have special enrollment periods where you have exactly 60 days to report changes. So this is your loss in your health coverage, change in your household size, permanent move, and then other marketplace eligibilities or enrollment errors. And then on the Medicare side, there are several different times to enroll. So first and foremost, you have your initial enrollment period. That's when you turn 65, 3 months before, 3 months after. Your annual enrollment, which is October 15th through December 7th. And this, for anyone who is on a supplemental and they are looking at a standalone prescription drug plan, this is the only time of year when you can change your plan. So what I tell my clients is I would say, go get your wellness check if you haven't during this time, so that on December 7th, if your doctor has prescribed prescriptions, we need to look at your plan, make sure that you're on the right plan so that you have the right plan by December 7th. And then if you're on a Medicare Advantage plan, then you can also make one change from January 1st through March 31st. And that change will go into effect the following month. And then special enrollment periods for this, there's a 2-year grace period. So let's say something happens on the 15th, you have till the end of that month and then 2 months after. And that's when you retire, move, receive assistance, or you're diagnosed with disability or chronic conditions. The good thing is, as employers, you get to choose your plan, date, start date, and all of that. So that kind of helps you out as an employer. And then we can stack on different things within the marketplace as well. So next steps, obviously, you can text APPT to 720-775-7353. There's a QR code, or you can just schedule an appointment with me at appt.ajgllc.com. And I want to thank everybody for coming out today. And I welcome any questions in a second, but thank you for being a part of BNI Rocky Mountain League's 8-minute presentation. Please join us. Our website is www.bnirme.com. Have a wonderful day.